So this was also a multi-center registry study from the European Society for Bone and Marrow Transplantation on another group which was understudied and underrepresented in all studies in myeloma, which is extramedullary disease. And in that setting we underwent a study on the role of maintenance therapy after first autologous stem cell transplantation for patients without and with extramedullary disease. And we found for patients without extramedullary disease, we confirmed the results that Lenalidomide single agent maintenance is superior to Thalidomide or Bortezomib. While in patients with extramedullary disease, the role was completely unclear. We found no difference for Lenalidomide, Thalidomide or Bortezomib, with a trend towards better outcome for Bortezomib, but only 10 patients received maintenance therapy with Bortezomib. So these results need to be repeated and undergone in larger studies. So it is important in that setting that patients with extramedullary disease need studies. They need studies like this, larger studies, to evaluate the role of therapy of different disease settings in that high-risk disease setting.